Hello, my name is Dr. Joanne Bazubitz, and I'm proud to be President and CEO of the Royal, one of Canada's leading mental health and research centres, where clients receive best-in-class care informed by cutting-edge research so that they may live their best lives. I would like to thank Rogers TV for the opportunity to host our Conversations at the Royal, where you will hear from many of our amazing clinicians and researchers who are passionate about the care they provide and the research that will lead to novel treatments and new discoveries in mental health and addictions. Today, Dr. Louise Overington will talk about the increase in substance use that people are reporting and how their lives have been impacted by the pandemic with heightened anxiety, loneliness, and low mood. Dr. Overington is a clinical psychologist with our Substance Use and Concurrent Disorders program at the Royal, where she helps clients experiencing a mental illness and difficulties with substance use. She is also a clinical research investigator with the Royal's Research Institute, with an interest in women's mental health and trauma-informed care, and provides ongoing training, workshops, and presentations to students and healthcare professionals on mental illness and substance use. Let's hear from Dr. Overington on how to recognize a problem and discuss positive coping strategies to manage stress and the challenges resulting from this pandemic. I am very pleased to introduce Dr. Overington.
So thank you, Joanne. I'm grateful to be able to speak about substance use and mental health in the context of the COVID-19 pandemic. It is an area that affects so many people, and it's important that we can share and learn, and particularly I'm keen to talk about some resources that people might look to. I'd like to thank Dr. Kim Curace for her contribution to this presentation. So I'm hoping that there are a few key points that you'll get from tuning in today. One is I'm going to start with an overview of substance use and talk a bit specifically about substance use disorders. I'm also going to talk about how substance use can interact with mental health and trauma, and the impacts of COVID-19 on the way people are using substances, and finally getting people to check in with themselves, check in with their loved ones. What are some coping strategies that people might use? And as I mentioned, turning to some resources. So this talk does focus on substance use, but I want to highlight that substance use is just one piece of a very complex puzzle. So there are lots of other things that are going to be going on in terms of substance use. So here's a visual to demonstrate the link between mental health, substance use, and trauma. So that often these three are overlapping, and there are a number of factors that might make people more vulnerable to experiencing some of these. So for example, poverty, someone's gender identity, disability, lack of access to healthcare, stigma, people might be experiencing that, sexual orientation, different age categories are more vulnerable. If there's any legal history, systemic discrimination, and also racial discrimination. So you can see many different factors can come into play for someone to be struggling with one of these issues. So in 2017, the total societal cost of substance use in Canada was estimated to be a massive $46 billion. And this led to 275,000 hospitalizations and contributed to the loss of 75,000 lives. So I know that those are just numbers, but when you think about each of those 75,000 lives, that's someone's brother or daughter or sister or mother. And so really wanting to make sure that we take a moment to recognize the huge impact of substances in Canada on people's lives, their families. So in Canada, what are people using? What drugs are people using? So after caffeine, alcohol is the most widely used psychoactive drug in Canada. So if you look at this graph, in green, we have the total, in blue, we have men, and in yellow, we have women. And you can see alcohol, almost 80% of people age 15 and older reported using alcohol at some point in the last year. And this study was done a number of years ago. And tobacco, far less, right? Fewer than 20%, cannabis, even fewer, and illicit drugs, even fewer. But all this to say is that substance use is part of our culture. People use substances, it's widely used, and certainly it doesn't mean that someone has a problem with substances just because they're using them. So let's look more specifically at drinking in Canada. So in 2017, about 78% of Canadians reported consuming alcohol in the last year. And there are two parts to this graph. One is the chronic risk guideline. And what that is that people are drinking at a rate that puts them at risk for long-term negative impacts. And the other one is the acute risk guideline. And that is that people are drinking at a rate that puts them at risk of acute injury. So you can see here in red, that's people aged 20 to 24. And almost 30% of people aged 20 to 24 are drinking at a rate that puts them at risk for long-term negative impacts, and 25% of risk of injury. So that's fairly high, and it's higher than both the other categories. So both people who are in the 15 to 19 age group and adults, so 25 years and older. If we look at cannabis use, this is a graph from the Canadian Cannabis Survey, and they've been collecting data just to also look at some of the changes that have happened with cannabis use post-legalization. And what you can see, so 2019 is in purple and 2020 is in green. And you can see that males report a higher percentage of cannabis use in the past year as compared to females. And that people between the ages of 16 to 24 years reported cannabis use in the past year at about double the rate of people who are 25 years and older. So this just gives us a sense of people's usage patterns. And finally, I certainly want to highlight opioids, right? Canada is in an opioid epidemic. There was lots of news around opioids prior to COVID, and that has quieted down a bit, but it is still here, right? So from January 2016 to September 2020, there have been more than 19,355 apparent opioid toxicity deaths in Canada. So that's a huge number. And I also want to highlight, in the 6 months following the implementation of the COVID-19 prevention measures, so from April to September 2020, there were 3,351 deaths. And this represents a 74% increase from the 6 months prior. So this data were released by the Public Health Agency of Canada, and they've hypothesized a few factors that might have contributed to this remarkable increase. One is that there's been a toxic drug supply. So with all of the lockdowns, the changes in borders, the drug supply has changed. I think people feeling increased isolation, stress, and anxiety. And also there's been a real disruption of services, particularly at the beginning of the pandemic, before people were able to pivot to virtual care. So people may not have been able to access the resources that they needed. So now that we have a picture of, what are Canadians using, specifically in terms of alcohol and cannabis and opioids, I want to move and speak about addiction. So to define addiction, it's a treatable chronic medical disease, and it involves complex interactions among brain circuits, genetics, environment, and an individual's life experiences. So really wanting to highlight that chronic medical disease component. And what we know is that prevention efforts and treatment approaches for addiction are generally as successful as those for other chronic diseases. So in the past, historically, people may have thought of addiction as a moral issue, ethical, and that's not how we understand it. Medicine really does view this as a disease, and one that we have successful treatments for. So one thing that I'd really like people to take away when we're talking about substance use, when we're talking about addiction, is changing how we're talking about it, changing the words that we're using. So using neutral, medically accurate terminology and using people-first language. So in this chart below, you can see a few examples. So if we're talking about people who use drugs or people who use substances, in the news, in the media, in our society, within the system, people sometimes have used terms like addicts or drug abusers. And we really need to turn away from that and use terms like people who use drugs, people who are struggling with a substance use disorder, people with lived or living experiences. We also want to stop using terms like clean, because that has a real negative connotation if someone isn't quote unquote clean. Again, talking about people who use drugs or who have used drugs or people in recovery. So being pretty mindful of language, because one of the number one barriers for people who are struggling with substance use is stigma. So the stigma around their struggle prevents them from getting the help that they need, the help that they deserve. So if we can all work to change our language, that may decrease the stigma and people may be more likely to reach out for help. So let's look at the spectrum of substance use. As I said, just because someone is using a substance certainly doesn't mean that it's a problem. It's frequent in our society, and we know, like, for example, LCBOs weren't shut during all of the lockdown. So it is recognized that people are using substances. But if we move a little bit further over, there's maybe a more frequent increase in use. And on the other side of the spectrum, we have problematic use. So what might make someone more at risk of problematic use and then in turn potentially developing an addiction? I want to highlight that anyone can develop a substance use disorder, but there are several factors that increase someone's risk. So the first here we can see is that there may be some vulnerability. So there may be a genetic predisposition, potentially if parents struggled with substance use or grandparents, right? If someone has mental health difficulties, and I'll talk more about that later, that really substance use and mental health co-occur frequently. If there's been a trauma or violence in their background, and also biological factors, right? So there may be sex and gender differences, and the way substances interact in someone's body can have can lead to different outcomes. Next, we have environment and sociocultural context. So someone struggling with lower socioeconomic status, if there hasn't been support from primary caregivers, peer group can have a big impact, right? If teenagers are experimenting and they get introduced to a substance, that can have an effect on whether they start using that more frequently. And then finally, the actual substance and the use pattern. So different substances have different ways of impacting the brain, different ways of impacting how people use it. And repeated use is the one requirement for someone developing addiction. Substance needs to be used over and over and over again. So if we are looking at that more problematic use, and we're looking at what we call the Diagnostic and Statistics Manual, and that's what mental health professionals, clinicians use for diagnosing a substance use disorder, there are 4 main categories that we want to be paying attention to. So first is that there may be some impaired control. And what I mean by this is someone's using more than they intended to use. So you may have planned to have, 3 drinks one night, and it goes to 6, goes to 7, and it increases. There may be a desire to cut down. So for example, someone smoking cigarettes, they're wanting to quit, and then the quit date changes, and that can get challenging. Time devoted to substance use, so getting the substance, using the substance, recovering from the substance, and also ongoing cravings. There may be some social impairments, so potentially not being able to fulfill work obligations, right? If you wake up and you've been intoxicated and you're not able to get in your car, drive, and go to work or perform at work, that can cause problems, right? This is another really important one, use despite problem. So even though someone may see, okay, this is causing issues in my life, I'm struggling, they're not able to stop their use. And it might mean that it takes over other things. So it might take over relationships or hobbies as it takes more and more time and it has a greater impact on someone's life. If we look at the yellow box, risky use, and this is different for every type of substance, right? So it might be that you're using in physically dangerous situations. So that might be using and then getting in a car, or maybe intravenous substance use. So recognizing that that substances really do impact people's decision making, they can increase impulsivity, and so risky use can happen if you're doing something that you need full concentration for, right? And then use despite physical or psychological consequences. So we certainly know that substances can have negative impacts on lots of things in the body. So on the liver, on lungs, and people can be aware of these and yet continue to use. Or from a mental health perspective, right? We know that there's some association between cannabis use and psychotic symptoms. And if someone's more vulnerable to that, it may be pretty risky to be using cannabis. And next we have our pharmacological criteria. And again, this is very dependent on the substance, but we look at two main pieces, right? The tolerance, so that you need to use more to have the same effects, or if you're continuing to use the same amount, it's having decreasing effects, and that there may be withdrawal symptoms. So after you've used, you go a period without use and you start feeling some of the withdrawal. Again, substance dependent, but it may be like some increased irritability, increased anxiety, maybe some physical effects as well. So that's a lot of information to take in. One way to really simplify it is by the 4 C's. So there's cravings for use, again, wanting to use that substance. There's this compulsivity to use. So this idea that it's on your mind a lot, you're thinking about how you're going to get the substance, when you're going to use it. Loss of control. So that's a really key point, right? So if a substance is there and someone is struggling with a substance use disorder, they're not going to be able to say no. That's the whole kind of piece of a substance use disorder. And that there's use despite negative consequences. So punishment and consequences don't generally work when someone's struggling with a substance use disorder, because that's another key piece of it, is that there's this inability to stop even when it's wreaking havoc in someone's life. So we've looked at in general substances and substance use disorders, and now we want to look at how COVID-19 has impacted this. So COVID has changed so many different things in our life, and this slide really just highlights a few of these. You know, we could fill this endlessly with bubbles of way COVID has impacted our lives. So economic stress, right? With all of the business closures, people losing their jobs, there's been housing insecurity, people can't pay their rent because of changes in their jobs. Certainly social isolation, right? We know how the virus spreads. We have had to physically distance, and that has often led to social isolation. There's been a massive increase in gender-based violence, and I'll speak more to that later on in the talk. We're consuming more news and social media. You really can't turn the news on and not hear about COVID. And it's there constantly, right? This overconsumption of information around COVID. There's increased stress and anxiety and loneliness as a result of this. And for some people who still have their work, right, essential frontline workers, there can be major burnout because there's a lot of pressure put on people to continue to show up for work. And it might also put people at risk of getting COVID because of their job. With school closures, there's been a lot of shift for parents in terms of having to do homeschooling, caregiving, and housework. So that's a lot more added to the number of stressors, the number of things people have to get done in a day. And then all of this stuff, right, we're likely doing less healthy coping strategies. We're probably not exercising as much, might not be spending as much time outside, doing those positive coping strategies that may be helpful, because there just isn't time or energy to do that as people feel so stressed. So how has this impacted people's substance use? So there was a recent survey done by the Canadian Centre of Substance Use and Addiction and the Mental Health Commission of Canada. And they looked at about 4,000 people aged 16 and older. And what I want to highlight here is that they collected data at 2 different time points. So one was the light green, was October and November. And the second was the dark green, and that was November, December, both of 2020. And what they found was about 30% of people who use alcohol report that they were using more during the pandemic. So slightly more or far more. And you can see that the percentage was higher for people who are struggling with mental health issues or who had struggled with substance use in the past. So anybody who's using is using more. People who struggle with mental health or substance use are using even more. And a similar trend for cannabis, really what we're finding, what CCSA and MHCC found, was that about 40% of respondents who use cannabis reported using more during the pandemic. And generally that was problematic use. And again, the same trend where there's a higher percentage of people with mental health and substance use concerns, right? So again, if you're using cannabis, you're using more. If you're struggling with mental health or substance use, the numbers are even higher. So the Canadian Centre on Substance Use and Addiction looked at some of the reasons for this increase in alcohol and cannabis use with the pandemic. And really what people were saying is that there's a lack of a regular schedule. So it becomes this strange, you no longer maybe go to work and then come home and have the beginning and end of the day marked. It's, you're getting up and maybe getting straight onto your computer, maybe not even getting out of pajamas, and then starting your work day. You're not meeting with people in person. It can bleed into the evening, to the weekends. And when you're at work, it's unlikely that you would have a beer or smoke a joint. But if you're at home, there aren't those same restrictions, really, and people may be turning to using at different times in different ways. Boredom is a huge one. That there's a lot more time on people's hands. Things are closed, social gatherings are limited, and people are trying to fill the time, and substances is one way that people sometimes turn to. As I said earlier, stress and loneliness. So how can I cope with this? And alcohol and cannabis can be a way to manage that. So we've discussed the impact of COVID on substance use. And as I said at the outset, substance use is just one piece of that puzzle. So I'm going to talk a little bit more about the impact on mental health, as well as the impact on trauma. So this is a graph showing the relationship between substance use and mental health. And there's really a strong link between substance use and mental health. And what we see here in the chart is that about 40% of people with an alcohol use disorder will experience some type of co-occurring mental health disorder in their lifetime. So that may be an anxiety disorder, maybe depressive disorder, post-traumatic stress disorder, any type of mental health disorder. And if we look at other substance use disorders, the number increases to over 50%. And what research has demonstrated is that substance use increases the likelihood of a co-occurring mental health disorder by 200 to 300%. So really, it greatly increases someone's risk. So the Center for Addiction and Mental Health looked more specifically at changes in people's mental health with COVID. So they did this in September of 2020, and there were about 1,000 adults that they surveyed. And what they found was that women reported experiencing significantly higher levels of anxiety and loneliness as compared to men. So both men and women were experiencing higher levels. Women were experiencing, about 25% said they were experiencing moderate to severe levels of anxiety, whereas men, it was less than 20%. And what they also found was that parents with children under the age of 18 who were at home were more likely to report feeling depressed. And you can see there are a lot more stressors put on parents, and now we're in another school closure, and that changes the parents' level of responsibility and the number of things that they need to be tracking during the day. I spoke a bit about gender-based violence and really wanted to highlight that the World Health Organization is calling gender-based violence the shadow pandemic of COVID-19. So recently, numbers were released showing that a staggering 243 million women and girls between the ages of 15 and 49 have experienced some type of sexual or physical violence by their partner in the last 12 months. And these are worrying trends that are happening across countries. Particularly, we've seen this in Canada as well, these increase in helplines. So the Women's Helpline fielded more than 71,000 calls between March and December of last year, when generally they've been fielding about 40,000 calls per year. So that's a huge increase. Some of those reasons, there's increased social isolation, economic insecurity, unemployment, lockdown, all of those factors make it harder for women to access services. And it may be, again, that complex connection that there's more substance use during this time, and that increases risk for trauma and violence. So given the potential impact that COVID has had on substance use and mental health and trauma, it's important to check in with yourselves and loved ones. So we're going to start by looking at just a few guidelines so you have more information. So Canada has low-risk drinking guidelines, and what they recommend to reduce your long-term health risks, so those are those chronic risks, for women not having more than 2 drinks per day and no more than 10 drinks per week, and for men, no more than 3 drinks per day and no more than 15 drinks per week. To reduce your risk of injury and harm, so those are the acute guidelines, they recommend no more than 3 drinks on any single occasion for women and 4 drinks on any single occasion for men. And also the guidelines are to plan non-drinking days every week. So what is an actual drink, right? You can pour a drink and not really have a sense of it. The 2 key pieces to be aware of are the volume and the percentage of alcohol. So for example, a beer around 341 milliliters is only 5% alcohol, where if we jump to wine, of course it's less volume, 5 ounces, because it's about 12% alcohol content, and then distilled alcohol, much less because it's much higher percentage alcohol, up to 40% percentage alcohol. So just be mindful of what an actual drink is based on those guidelines. And Canada also has lower risk cannabis use guidelines. A few key takeaways from this are being aware of the product you're using and using lower THC content, so lower than about 10% THC. Being aware of how you use it. So smoking is one of the most harmful ways, so using a joint, for example. It's less harmful if you vape or use edibles, but of course there are risks with those too. And not driving at least 6 hours, but potentially it can be in your system for up to 24 hours to reduce risk. Sometimes people think that, it makes me more cautious, I'm paying more attention, and what we know is that it decreases people's response time, and vehicle accidents happen very quickly. So if your response time is compromised, that's likely going to put you at higher risk of getting into an accident. The guideline here, www.checkyourdrinking.net, is a fantastic resource, and you can look at drinking, you can look at cannabis use, smoking, depression, anxiety. It's an anonymous quiz. You go through, fill out a whole bunch of information about your, for example, alcohol use patterns, and then it gives you your results. It gives you information about how much money you're spending, how many movies you could have gone to, and based on how many calories are in the alcohol, for example, how many slices of pizza you could have had, and just compares your results to other people in terms of what your risk level might be like. So this just can be for you to gather information on yourself. It might also be something that you take to your physician or nurse practitioner or healthcare professional and say, look, I took this quiz. I want to talk a little bit about where I'm at with things if you have concerns. And of course, important that we talk about opioids. So there are 2 key points in this infographic from Ottawa Public Health. One is that any substance can be cut with fentanyl, can be mixed with fentanyl, and fentanyl is a much more potent opioid and can lead to overdose. Being aware of the signs of an opioid overdose, so breathing might really slow, lips and nails might go blue, the person may not be responding even if you're trying to wake them up, they might feel cold and clammy, and their pupils might be really tiny. Anybody can go get a naloxone kit from their nearest pharmacy. They'll do some training, give you some information about it. It's a helpful thing to have on hand. You wouldn't be using this on yourself, maybe using it on a friend or a teenager or someone. If they have taken opioids and it has led to an overdose, this can help save their life. So now we've talked about the struggles, but I want to acknowledge that sometimes it's not easy to get the help that you need, that you deserve. So we know that there are barriers to access in terms of treatment, and sometimes the system can be difficult to navigate. We know from a study that our team recently did was that women report greater barriers as compared to men when it comes to family responsibilities, relationships, mental health. So they may be worried about childcare, they may be worried about, violence in their relationship if they seek help. Potentially they're struggling with a mental health disorder that makes it challenging to reach out, like depression. And we also know that women report greater perceived stigma than men. So as I said previously, stigma is one of the key barriers to accessing care. And so both women and men are experiencing it. Women are experiencing it at a higher level, and women who are using opioids are experiencing it at an even higher level. So there are often lots of barriers for someone reaching out for help. So how can you take care of yourself? What are a few steps that you can start taking today if you're noticing, that you're starting to struggle a little bit, maybe with your substance use increasing, maybe that anxiety is creeping up, you're feeling stressed, your sleep's impacted. So substance use, you can monitor your use. How much are you using? How often are you using it? You can follow those guidelines to reduce your harm. So being aware that those guidelines exist. Avoid stockpiling. So at the beginning of the pandemic, when there was a potential risk that LCBOs, for example, were going to close, people started stockpiling. And that could become problematic if we think back to our definition of a substance use disorder, that there's a loss of control. So likely if you have it there, you're going to use it. Keep taking your medication as prescribed and reach out if you feel your use is becoming a problem. And as I said, I'll outline a number of resources that you can reach out to. In terms of coping strategies, one of the most important is really staying socially connected. So it's been said that the opposite of addiction is connection. So now more than ever, it's important to help your loved ones find ways to connect with other people, even if we have to be physically distant, right? So encourage virtual ways of connecting. Many different community organizations have pivoted to virtual, so you can find lots of resources online. Another one is to keep informed, but to also set limits, right? So wanting to make sure you choose a credible source like Ottawa Public Health to get your information about COVID-19. At the beginning, I know for myself, I was checking the news constantly. I was looking at the numbers, how have things changed, how can I stay on top of it? And I really had to set boundaries around when I could check the news, not checking it right before bed, and limiting that media exposure. So ask yourself, how much time in the day am I not thinking about, reading about, or talking about COVID? And if you're spending the big chunks of the day doing it, this is one way that you can start making some changes. In terms of coping strategies, staying active. So, the guidelines are closer to 20 to 30 minutes of a day. Here at the hospital, sometimes we start a group with 2-minute physical exercise, and people report finding positive changes with that. Putting some structure in your day. So again, that lack of routine can lead to increased anxiety, increased stress, increased substance use. So figuring out, when are you going to start your day? When are you going to have breaks? How are you going to be able to turn things off? Maybe putting your work laptop away, trying to move into another space when work is done. Focusing on what you can control, because there has been so much uncertainty. There are so many things that we can't control. Figuring out what can you, right? You can control how much media exposure you have. You can control wearing a mask. You can control washing your hands. So focusing on those few things. Trying relaxation or mindfulness, right? Because there's that increase in anxiety that can come. Doing relaxation and mindfulness can help bring that down. The Healthy Minds app is an interesting app that the Royal put together that can help check in with yourself and give you ideas of strategies to use to manage some of those distressing feelings. So where can you go for help? So in terms of resources, Access MHA is a new resource. It's kind of this one-stop shop for mental health and addiction services. It's one referral, one assessment process, and I'm going to play a little video so you can just see.
Do you or a loved one need help with mental health, substance use, or addiction? Access MHA is a single portal through which residents of Eastern Ontario who are 16 years of age and older can access mental health, substance use, and addiction support when they need it. The healthcare system can be complex, confusing, and overwhelming. Access MHA provides a clearer path and simplifies access to mental health and addictions care for everyone. Just fill out a simple form at accessmha.ca to book a confidential phone call with a mental health and addictions professional. You'll be connected to services that will meet your needs. All services are funded by the Province of Ontario, and there's no cost to you. If you are concerned about your mental health, substance use or addiction, or that of a loved one, go to accessmha.ca.
So there's some information about Access MHA, and really I'd say that's the first place to go when you're trying to reach out for help. There are a couple of other options: service access to recovery, so that's substance use. It's assessment that can refer you to a program for free. The Royal Ottawa Rapid Action Addiction Medicine Clinic, you can check out the website or call. Ottawa Withdrawal Management is another substance use resource. Wellness Together, you have a link here. Of course, your family doctor and nurse practitioner, your EAP, and then there are self-help meetings, and most of these have pivoted to online. So AA, NA, Smart Recovery. In terms of gender-based violence, again, because we know that this is something that many women are struggling with, having some resources. So Assaulted Women's Helpline can provide online chat. The Crisis Text Line provides free 24/7 support. Sheltersafe.ca gives information about any shelter and the shelter that may be closest to you. And then My Plan Canada is a free app that can help you make a safety plan for your well-being if you've experienced or are experiencing intimate partner violence. So thinking about how you are doing and what one thing you can do today to promote your wellness. Thank you.